how do you go about gaining that person's trust so that they could open up to you and feel that they're in a place of comfort, that it's not a danger?
That starts with the very first phone call that they make to me, because I spend the time talking to them. I'm not just somebody who picks up the phone and hangs up. You know, I try to give people information and education, and even if they can't actually come in and see me or whatever, I try to give them something. The next thing is when they come in, because our offices are not sterile it's not like a sterile doctor's office. I have it, this is my second home, okay, and I have it set up that way. So you come in and you're like in a living room, you're in a big living room, and this is your place and your space, and it's a healing place, and you know that you're in the hands of somebody who's positive and who's there to heal. And we serve them, we treat them. It's like you're coming to my home, and you're special. You're not just anybody walking through the door. You're not just any other patient. You're a special person. I also work with some celebrities too, and people who are very high profile, and they like that kind of treatment. But the bottom line is we treat everybody that way. And the environment is a simulated environment of how people are supposed to be treated, of how it's human. It's how you're supposed to treat someone. And in this environment, people are really growing, and they're experimenting with new aspects of themselves that are coming out, whether it be they're showing emotion that they haven't showed before, they're able to laugh, and maybe they haven't laughed in a while, and they feel comfortable in that atmosphere. So then that gets translated into everyday life. So it becomes an experimental zone. The third thing is that I start with an assessment and strategy session, and I have a series of questions that I ask about the person and their life. And as I ask these questions, the person can see from that very first session how I can piece together and know things about them before they even tell me. And they would be like, well, how do you know that?
Psychic?
No, but for example, I might ask a person might reveal to me that maybe they were a self-harmer, right? So I would find out when that happened. I would find out where they were a self-harmer, where they cut. Now, if they cut on their thighs, that gives me information about them that I'm saying to myself, oh, okay, they cut on their thighs. Maybe there was some kind of sexual abuse that went on here. Now, they don't know that I would know that, but there's certain clues that they're revealing to me, not even knowing that they are. And then that kind of will lead me to other questions. And then before you know it, they're revealing stuff to me because it's the truth. I've figured it out. And they feel comfortable in that. And so I can piece things together about how someone is developed. And by the end of that, they feel very comfortable, like I know what I'm talking about, and that I can really help them to understand and to grow.